How to choose essential bone health supplements for osteoporosis. Choosing the right bone health supplements for osteoporosis is essential for supporting bone strength and reducing fracture risk. The primary focus should be on calcium and vitamin D, but individual needs and safety must also be considered. Calcium is a key mineral for building and maintaining strong bones. For adults with osteoporosis, the daily requirement typically ranges from 1,000 to 1,200 milligrams, depending on age and sex. It is best to get calcium from dietary sources like dairy products, leafy greens, and fortified foods. If you find it hard to meet your calcium needs through diet alone, calcium supplements can be a good option. When selecting a calcium supplement, consider the type. Calcium carbonate is effective but needs stomach acid for absorption, so it should be taken with food. On the other hand, calcium citrate can be absorbed on an empty stomach and may be better for older adults or those with lower stomach acid levels. It is important not to exceed the upper intake level of calcium, which is generally between 2,000 to 2,500 milligrams daily, to avoid potential risks like kidney stones or cardiovascular issues. Next, vitamin D is crucial because it enhances calcium absorption in the gut and supports bone remodeling. Adults over 50 with osteoporosis are usually advised to take 800 to 1,000 international units of vitamin D3 daily. Some individuals may need higher doses based on their blood levels and healthcare provider recommendations. Both vitamin D2 and D3 supplements are effective, but vitamin D3 is often preferred for maintaining adequate vitamin D levels. You can take vitamin D supplements with or without food, and they do not need to be taken at the same time as calcium. Additionally, vitamin K may support bone health by assisting in bone protein synthesis, with a recommended daily intake of around 90 to 120 micrograms. However, the evidence for its effectiveness is less definitive, so it is best to discuss this with a healthcare provider. When choosing supplements, consider your personal health status. Conditions like kidney disease or gastrointestinal issues can affect absorption and requirements. Also, check your current medications and supplements to avoid excessive intake of vitamin D or calcium. Start with lower doses of calcium supplements, around 200 to 300 milligrams daily, and gradually increase to improve tolerance and minimize side effects like constipation. Always consult a healthcare provider to tailor your supplementation based on bone density tests, blood levels of vitamin D and calcium, and your overall health. Remember, supplements should complement a balanced diet rich in calcium and vitamin D, along with lifestyle measures like weight-bearing exercise and full prevention strategies. They are part of a comprehensive osteoporosis management plan that may include medications prescribed by a healthcare professional. In summary, choosing essential bone health supplements for osteoporosis involves focusing on adequate calcium and vitamin D intake tailored to your individual needs. Ensure safe dosages and integrate supplementation with medical advice and lifestyle interventions for the best outcomes.